Hello dear colleagues, how are you today? I hope you are well. Here we are going to explain another question of cardiology. A 60-year-old woman with a history of ischemic heart disease presents to accident and emergency with progressive dyspnea. She has had previous admissions with heart failure in the past year. She has a respiratory rate of 34 breaths per minute and a systolic blood pressure of 90 mm Hg. Her oxygen saturation is 88% on room air. On examination, she looks pale and sweaty and has widespread crepitations of both lung folds. Oxygen by face mask was commenced. What is the single most appropriate next step in management? Okay, here we have a 60-year-old woman with a history of ischemic heart disease is coming with the signs and symptoms of acute pulmonary edema. The patient is hypotensive. Her blood pressure is 90, which is not a normal blood pressure for a 60-year-old woman, and she is hypoxic. Her blood saturation is 88%. She is coming with chief complaint of shortness of breath. She has a sweat and has widespread crepitation of both lungs fell. It means that the patient has pleural effusion because of cardiac failure. And here we are going to read the choices. A. Bendroflumethiazide. The answer is asking about appropriate single most appropriate next step in management of the patients. Okay. A. Bendroflumethiazide. B. Furosemide. C. Aspirin. D. Carvedilol. E. Spironolactone. Okay. The best choice here we have furosemide for the management of the patient's signs and symptoms because the patient has fluid overload, and the best choice is furosemide. Here we are going to explain it. This patient is suffering from acute pulmonary edema brought upon by heart failure, and the best choice, as we said, is furosemide for alleviating the patient's signs and symptoms. Furosemide is a potent loop diuretic which plays a crucial role in managing conditions like congestive heart failure, hypertension, and edema by effectively reducing fluid retention through its action on the kidney's loop or handle. By inhibiting sodium reabsorption, furosemide promotes diuresis, thereby reducing extracellular fluid volume and relieving symptoms associated with fluid overload. However, its use requires careful monitoring of electrolyte levels, particularly potassium, to prevent adverse effects such as hypokalemia. Overall, furosemide remains a cornerstone in treating conditions characterized by excessive fluid accumulation, providing significant relief and improving patient outcomes. It was a short explanation about the furosemide importance on the patients coming with acute pulmonary edema or any other types of edema for their management of acute signs and symptoms. Thank you for your attention.